Hello, and thanks for joining me once again. Today, I'm joined by John Talaga, who is the Executive Vice President for Healthcare at Flywire. John, thanks for joining me.
Thanks for having me.
John, I've read a little bit about Flywire in our news, and I know that Flywire helps manage hospital payments for patients with high deductibles. Can you, in just a few sentences, explain what that means to a layperson?
Yeah, so historically, most of revenue that came to hospitals came from insurance. And since the Affordable Care Act, deductibles increased and the patient responsibility portion went from what it used to be 10% to about 30%. So because of that, there's been a downstream impact on providers as well as the patient affordability. So what we do is we help providers identify what patients are at risk of making a payment at all, and we help make it easier for them by establishing payment options.
I see. Has the need for this sort of service grown, and if so, by how much, and what are we talking about?
Yeah, so it's particularly grown over the last couple of years just organically, primarily because hospitals previously would send statements out. They would have an online bill pay component. They would take payments via check and online. But really what's kind of driven this is, if you think about it, hospitals are really competing for the consumer's attention. It's not traditionally a hospital bill that they would have a lot of recourse in having to pay. They might go to collections. And so the engagement of that patient has become much more important and as important as identifying and getting them to pay. So the combination, which is really picked up in terms of the demand, if you will, is engaging patients differently, digitally, text, email, chat, as well as getting them to pay based on what they can afford, their capacity to pay. So the demand for this has grown tremendously over the last 2 years. And then since, of course, COVID, it's exacerbated the issue in terms of the financial strain on consumers. So it's also increased the demand for it recently as well.
So would you say that Flywire is an alternative to a collection agency?
Well, so it's a great question, because one of the things that in revenue cycle management within hospitals, it's a very complex process and environment, right? So we've got collection agencies that are bad debt collections. So after they've exhausted all efforts to collect, and then there's what they call early out collection agencies, in which hospitals are outsourcing some of the call, follow-up, and some of the revenue cycle management services to those companies. So what Flywire is the technology that sits on top of the EHR and the billing system to optimize how it works with engagement and payment options. So what we're helping hospitals do is reduce the amount of placements they have to send to collection agencies by automating through self-service patients to be able to make a payment. Agencies, whether it's bad debt or early outs, are very necessary for patients that are just not responding. But at the same time, if you engage patients the right way with what they can afford and a digital way they're willing to respond to, text as an example, then there's less need for an agency for having to take that account over, which is very expensive to hospitals.
Are there stats on how successful this sort of thing is as an alternative to collection agencies?
Yeah, so we have, as you would guess, with our clients, and by the way, we service 4 out of the top 10 health systems in the country, and we touch about 30% of households in the U.S. So our own stats in terms of what we're driving for providers in the aggregate benchmarks is very valuable to other customers to see how they're doing. And what we see on a consistent basis is a 25 to 30% decrease in placements to early out and collection providers. And again, some of that's low-hanging fruit, that if you just ask the patient to make a payment in the right way, they'll make a payment. And then others doesn't matter if you ask them the right way or not, they can't afford it. So it's also changing the amount they owe. So let me give an example, which is really, I think, will be helpful to the listeners, is that if I owe a $2,000 balance, and the average balance at a hospital is anywhere from $1,500 to $2,000. So if I owe $2,000 and my savings account has $400, which is what 50% of patients have, is about $400 in their savings account, I can't make that payment. So it doesn't matter how often that you ping me with a statement. The collection agency will ultimately call me, and they'll set me up on a payment arrangement that I can afford, and the provider is going to pay that collection agency a lot of money. And it's an uncomfortable experience for the patient. So what we're doing is up front, we're using analytics to identify what that patient's ability to pay is. So we know that John at $2,000 can't afford to pay $2,000. So the very first interaction that comes to him from the hospital is, you've qualified for a $100 a month payment per month, something that he can afford per month. So that's getting more of the patients to pay, which is what results in that 30% decrease of placements, which saves a lot of money and makes the experience for the patient much greater.
I see. Well, that's a nice it's a nice service, I suppose,
Right.
without a doubt, because a lot of people can't afford to pay their health insurance, and so my hat's off to you. How about we hear a lot of people talking about Medicare for all. What would happen to your industry if Medicare for all was adopted?
Well, so first of all, if Medicare is adopted, there's still going to be a private industry in terms of insurance. Even some of the countries that have, insurance for all, if you will, public, there's still a private industry. So we think that for a long time, it's going to take for patients to change, or even companies to change the insurance side of things. But either way, there's going to be some level of patient responsibility and consumerism involved. Like, one of the things you hear about, I'm sure, within your publication is price transparency. So knowing what it's going to cost for a particular service. At some point, there's going to be that consumerism and choice of where they go based on how acute or the service is, the procedure, and what they choose to go to. So sometimes they may choose a simple procedure that might be for Medicare for all, for a hospital that's easy. But if it's something that's more acute and life-threatening, typically patients are going to choose the best care of all. And typically there may be a responsibility for the patient there. So we don't see that changing anytime soon. Even if it was adopted, there's going to be certainly a slow migration, and our company, will always adapt.
Well, John, I want to thank you very much for joining me. I hope that if we visit again in 10 years, that the average person has more than $400 in their bank account. It's a sad state of affairs, but it's true. And thank you for joining me. You have a very interesting company.
Thank you very much, Phil. Appreciate you having me.